Apistarchosis clonarchosis. Apistorchis viverini, common name Southeast Asian liver fluke, is trematode parasite from the family Apistorchidae that attacks the area of the bile duct. Infection is acquired when people ingest raw or undercooked fish. It causes the disease opistarchosis, also called clonarchosis. Opistorchis viverini infection also predisposes the infected for cholangiocarcinoma, a cancer of the gallbladder and or its ducts. Opistorchis viverini is endemic throughout Thailand, the Lao People's Democratic Republic, Vietnam and Cambodia. Causative agent is Trematodes flukes, Apistorchis viverini, Southeast Asian liver fluke, and Clonorchis sinensis. The adult flukes deposit fully developed eggs that are passed in the feces. After ingestion by a suitable snail, first intermediate host, the eggs release miracidia, which undergo in the snail several developmental stages, sporocyst, redia, cercaria. Cercaria are released from the snail and penetrate freshwater fish, second intermediate host, insisting as metacercaria in the muscles or under the scales. The mammalian definitive host, cats, dogs, and various fish-eating mammals, including humans, become infected by ingesting undercooked fish containing metacercaria. After ingesting the metacercaria exist in the duodenum and ascend through the ampulla of Vater into the biliary ducts, where they attach and develop into adults, which lay eggs after 3 to 4 weeks. The adult flukes reside in the biliary and pancreatic ducts of mammalian host, where they attach to the mucosa. The adult worms can live for many years in the liver, even decades, shedding as many as 200 eggs per day, which pass out via bile into the chyme and feces. The lifespan of Opistorchis viverini is over 10 years. Most infections are asymptomatic. In mild cases, manifestations include dyspepsia, abdominal pain, diarrhea or constipation. With infections of longer duration, the symptoms can be more severe and hepatomegaly and malnutrition may be present. In rarer cases, cholangitis, cholecystitis, and cholangiocarcinoma may develop. In the acute phase, abdominal pain, nausea, diarrhea, and eosinophilia can occur. In long-standing infection, cholangitis, cholelithiasis, pancreatitis, and cholangiocarcinoma can develop, which may be fatal. Diagnosis is based on identification of eggs in stool specimens with a microscope or in duodenal aspirate. More than one stool sample may be needed to identify the eggs. The eggs of Opistorchis are very similar to those of Clonorchis, another liver fluke. The adult fluke can also be recovered at surgery. Opistorchis is readily treated using a single oral dose of the drug praziquantel annually. Another choice of drug is albendazole. Prevention involves preventing fecal parasites from reaching the water supplies, decreasing snail host, and promoting adequate cooking methods for the second intermediate host fish. Much of this involves educating the local people about the risk associated with liver fluke infection and what they can do to minimize them. Fasciolosis. Fasciolosis, also known as liver rot, is an important helminth disease. This disease belongs to the plant-borne trematode zoonosis. Fasciolosis is now recognized as an emerging human disease. The World Health Organization has estimated that 2.4 million people are infected with fasciola, and a further 180 million are at risk of infection. Human and animal fasciolosis occurs worldwide. While animal fasciolosis is distributed in countries with high cattle and sheep production, human fasciolosis occurs, except in Western Europe, in developing countries. Fasciolosis occurs only in areas where suitable conditions for intermediate host exist. In Europe, the Americas, and Oceania, only Fasciola hepatica is in concern, but the distributions of both species overlap in many areas of Africa and Asia. Disease is caused by two trematodes Fasciola hepatica, the common liver fluke and Fasciola gigantica. The definitive host range is very broad and includes many herbivorous mammals, including humans. The life cycle includes freshwater snails as an intermediate host of the parasite. Immature eggs are discharged in the biliary ducts and in the stool. Eggs become embryonated in water. Eggs release miracidia, which invite a suitable snail intermediate host. The cercaria are released from the snail and insist as metacercaria on aquatic vegetation or other surfaces. Mammals acquire the infection by eating vegetation containing metacercaria. Humans can become infected by ingesting metacercaria containing freshwater plants, especially watercress. After ingesting the metacercaria exist in the duodenum and migrate through the intestinal wall, the peritoneal cavity, and the liver parenchyma into the biliary ducts, where they develop into adults. In humans, maturation from metacercaria into adult flukes takes approximately 3 to 4 months. The adult flukes reside in the large biliary ducts of the mammalian host. During the acute phase caused by the migration of the immature flukes through the hepatic parenchyma, manifestations include abdominal pain, hepatomegaly, fever, vomiting, diarrhea, urticaria, and eosinophilia, and can last 4 months. In the chronic phase caused by the adult fluke within the bile ducts, the symptoms are more discrete and reflect intermittent biliary obstruction and inflammation. Occasionally, ectopic locations of infection, such as intestinal wall, lungs, subcutaneous tissue, and pharyngeal mucosa, can occur. Laboratory diagnosis, microscopic identification of eggs is useful in the chronic adult stage. Eggs can be recovered in the stools or in material obtained by duodenal or biliary drainage. Treatment. Unlike infection with other flukes, Fasciola hepatica infections may not respond to praziquantel. The drug of choice is triclabendazole with butanol as an alternative. Prevention. Control of aquatic plant industry. Wash aquatic plants in vinegar, health education, clean water.